Today I would like to talk to you about diabetes, the types of diabetes, the risk factors, and the complications with having diabetes. Did you know that diabetes is the #1 leading cause for kidney failure, or that approximately 371,000 people in Mississippi have diabetes? I'm sure a lot of you have heard of diabetes, but do you know about the complications and risk factors that diabetics may go through? I can present this information to you today because I have done a lot of research on this topic, and also because my dad has been a diabetic for 15 years, so I already know a lot about this topic. The purpose of my speech is to inform you about the different types of diabetes, risk factors, and complications. However, if you already know about diabetes, I hope to also give you information you may not know about. Diabetes is a disorder of metabolism. Also, someone with diabetes, depending on the type, may or may not produce enough insulin. First, I'd like to tell you that according to WebMD.com, type 1 diabetes happens when the immune system destroys cells in the pancreas. Your body needs to produce insulin to help move sugar and glucose to body tissues. The cause of high blood sugar is from glucose building up in your blood, which then makes your cells starve. Type 2 diabetics make insulin, but their bodies do not use it like they should. Being overweight can also cause insulin resistance. People who are overweight are at more risk to being diagnosed with diabetes, as well as overweight children. I'd like to also tell you about the risk factors that go along with having diabetes. If a parent or a sibling has diabetes, you are at a higher risk for being diagnosed. People with a low vitamin D consumption are also at a high risk for type 1. Sometimes even a viral illness can play a role in diabetes. Risk factors for type 2 include your weight. If you're obese or overweight, the fattier tissues you have, the more resistant your cells become to insulin. Also, the less active you are, the higher risk you are to becoming diabetic. The risk of diabetes increases the older you get. However, type 2 diabetes is also occurring in more children every year, according to the Mayo Clinic. If you have a high blood pressure, you're also at risk. Finally, I'd like to go over the complications of diabetes. Cardiovascular disease can include coronary artery disease, heart attack, stroke, and the narrowing of arteries. If you have diabetes, you are more likely for a heart attack or a stroke. Neuropathy can cause tingling and numbness, burning or pain that usually begins in the tips of the toes or fingers. If neuropathy is left untreated, it can cause you to lose all feeling in the affected limbs. Damage to the nerves related to digestion can also cause problems with nausea, diarrhea, and so much more. Diabetes can also cause severe damage to the kidneys, which can cause failure or irreversible end-stage kidney disease. Nerve damage in the feet due to poor blood flow can result in toe, foot, or leg amputation. Also, eye damage, skin conditions, hearing impairments, and Alzheimer's disease are all complications of having type 1 and type 2 diabetes. In conclusion, my purpose of this speech was to inform you on diabetes and all the health issues that go along with it. I discussed with you the 2 different types of diabetes, the risk factors, and complications. Again, I felt qualified to discuss this information because I have been around with someone with diabetes for a long time, and I've also done a lot of research on this topic, which gave me a lot of information as well. I hope I gave you enough information that can discuss diabetes with someone else, and if anyone in your family ever gets diagnosed with diabetes. I hope that you know enough to be able to go over it with anybody that you talk to. Okay. Word.
Word.